Okay, thank you. Hi, good evening. It's hard to believe that it's fall and we have this great, beautiful weather, beautiful evening. Hope everyone's getting used to the shorter days, cooler mornings, and crisp evenings. Tonight's our 8th board meeting of the year, and after tonight, we have just October and December meetings left for 2021. Certainly seems like the year's gone by awfully quick. I would now like to call the regular board meeting to order. Meeting called at 6:03. The roll call, Jim Anderson.
Present.
Dr. Fallow Lane.
Here.
Maria Hickey.
Here.
Jennifer Moff.
Here.
Carolina Smith.
Present.
Cindy Sutters excused, and Dan Sutter is here. I'd like to go to the Woodland Memorial. We extend our sincere condolences to the families of the fallen people who have passed away since our last meeting. Hayden Chase Kinsley. Hayden, age 17, passed away Wednesday, August 18th. Hayden was a student at Perry High School, received services from the SSA department. Todd W. Mead. Todd, age 51, passed away Thursday, September 9th. Received services from the SSA department. Zandon Yanis Taylor. Zandon was born Friday, July 9th. Passed away Friday, August 27th at 7 weeks old. He received services from the early intervention. Let's have a moment of silence to honor the two passing. Okay, thank you. Need a motion to approve the minutes from the regular board meeting of August 24th.
Fallow Lane moves.
Anderson seconds.
Any additions, revisions, or corrections? With none, all in favor of approval of board meetings, say aye.
Aye.
Will say nay. No abstentions. The meeting minutes are approved. At this time, we'll look at anyone for public speaks. Doesn't look like we have anyone for public speaks, so we'll go to the president's report. Good evening again. As a reminder for the board members, the Relias online training has been assigned to us, and we want to go onto the Reliance site and have this online training completed by November 30th. If you need any assistance, please contact Connie Bolton or Kakina Sagan. I was able to get on the site and complete one of the trainings, so it's pretty good. The trainings are corporate compliance and ethics, and IDD and trauma, road to recovery, supporting children with IDD who have experienced trauma. And they're both 1 hour. Next, the Ohio Department of Developmental Disabilities has informed us that our accreditation survey will be conducted March 2022. We know that Bill and his team are readying themselves for this critical review, which is now 6 months away. We'd like the employees to know that we appreciate the work that they do each day in and day out to make sure people's needs are getting met, as well as ensuring that we are in compliance with the standards set for us. We as board members, we have an appreciation for the multitude of requirements that Medicaid and the Developmental Disabilities have set forth, and the rules and regulations that must be followed. We know you're living it, and on behalf of the board, we sincerely thank you for working with you each day and then making sure our people serve our needs get met. So next, I don't want to steal Lisa Paramore's thunder, but next month is the great conference. It's October 30th, and it's fun. The fun events are going to start to be. And now I can't conclude my report without a big shout out to you. Not only because of the work she's done throughout her 41 years with United Way, but also for service at countless boards that were dedicated to making Stark County community better. We thank you, Maria, and for your work that has made Stark County a better place. This concludes the president's report. Superintendent's report.
So formal good evening to you. I hope you're well. Just so you know, I did get a text just around 5 o'clock indicating that one board member wasn't going to be here because of good weather. Wanted it canceled because of good weather. Just to tell that person that she is retiring. And it's amazing, yeah, she's much more bold in regards to saying exactly what she wants now. So, Marie, we're so excited for you. It's been just an honor and privilege to work beside you on the Family Council and all places that we have lost paths and certain. So today, Mr. Superintendent's report, we're going to do three things. We'll try to be cover a great amount of time, or a great amount of territory. Don't want to cover a great amount of time, a great amount of territory in a short amount of time. So we talked last month on the workforce crisis, and certainly talked about some strategies, the emphasis on sharing services. The Department of Developmental Disabilities, the County Board Association, and the Ohio Provider Association has gone out to the hotspots in the state and held listening sessions. And they provided this guidance for county boards to kind of be making sure that we all have a plan to address things. So in regards to county board leadership, it's basically establish a communication plan. Agency staff, providers not available. So we have Ed Lewis, who's provider clients and support. We do have a plan in case of these emergencies. So just we need to be able to deploy staff for these emergency situations. I'm not going to go over all the issues except and really for county board leadership, basically have a plan, be able to address emergencies when providers are unable or they walk away, and make sure we have a good plan in place. This is really where I want to focus just our attention is really on the SSA department and our SSA staff, which these are the strategies put forth statewide, and certainly are things that we've always attempted to do. Safely decrease current supervision levels when people require one-on-one staffing or two-on-one staffing. Reduce two-on-one staffing. Prioritize the greatest activities of daily living needs. So is it toileting? Is it feeding? And making sure that that's square in the plan to ensure that person's safety. Simplify crucial outcomes and action steps in individual service plans. We make sure that they are implementable by the staff that are out there. Then reassess on-site on call. Increase assistive technology where possible and remote support. So we are a technology first state, so technology and remote monitoring should be our first line of defense. And once that's ruled out, if that's not possible, then we go to, staffing needs. So that's the core part I wanted to include today, and this is guidance coming from the state. Though we really have that baked in, but we're going to be looking at it with Amy. In her department more so than ever before on seeing who is living alone, who has two-on-one staff, and look at measures where we can reduce appropriately. There are still going to be cases, and many out there, where two-on-one is appropriate because that is certainly what that person needs. But in places where it has run its course, and we're going to try to reduce those areas that are heavily staffed. So, and then finally, for the provider community, I'm not going to emphasize that, but establish ongoing DSP appreciation plan, and we help fund this with gift cards, meals, gas cards, and other supports we're going to continue with. And do those things that we kind of did through the pandemic. We're going to keep those activities going forward. Because this situation is not going to be solved this year or next. This is going to be something that's with this 2 to 3 years for sure. So wanted to share that this is guidance being provided to all county boards to make sure, number one, there's plans in place, that all SSAs and departments across the state are really looking at revising ISPs to make sure that the outcomes are minimal as providers struggle to cover shifts, and that the shifts they're covered are often from staff that are working 40, 50, and 60 hours. So this is our landscape right now. I do want to next kind of shift gears and look at where we are levy wise. So have a 1.9 mil and 1.4 mil expiring in 2023. It becomes effective in 2024, but expiring in 2023. We do expect to go for a renewal at this time, and that will occur May 2023. We're going to try to have that renewal levy extend for sure 5 years, and if at all possible, we're going to try to extend it 6 years. So that's going to take fiscal restraint right now. We're really going to concentrate on only spending 97% of our budget. And that will assist us hopefully to stretch that extra year to be a 6-year renewal levy. So we're going to have to watch that closely in 2022 to make sure that that is possible. So as a reminder, with our budget, just kind of really high level, every year we budget $1.1 million increase for waiver enrollments, and then an additional $210,000 to hire 3 new SSAs. So that is baked into what we are doing with the needs that we have. Our SSA department has gone very efficiently to the waiting list assessment as it is being implemented throughout the state right now. And we only enroll people on home community-based service waivers if there's immediate need. An immediate need can be defined as a substantial risk of harm if something is not done within 30 days to either that person, their caregiver, or the person. So what we know, that is what we follow, and those are the only waiver enrollments we are doing for the individual option. Now the level 1 waiver, we still continue to offer those primarily to people that are transitioning from school to adulthood, but not exclusively, but primarily to that are transitioning. Certainly some school-age children are getting level 1s if it meets their needs and they have an immediate need. So we looked actually this week, it's like, is there any way to do more cost containment as we look at how far we are able to go with next levy request? And right now, again, when you just look at waivers, it's such a large part of budget and our mandated responsibility. There does not seem to be a way to do anything other than what we're doing right now. That $1 million increase plus the addition of 3 SSAs. As you get it, it's not a great business model. I mean, so every year we have pretty much the same amount of money, but our expenses are increasing really almost $1.5 million to include the SSA costs. So that's meeting immediate needs in our county where it has for some time. So just to illustrate what that means for next year. So our waiver match cost is equal to the salary and benefits we pay 380 people. It is more than our wages by nearly $10 million. And by 2030, it's going to be 50% of our budget. And then, but our revenue is kind of staying the same. So that is kind of the landscape in which our service delivery is operating. We are no different than Summit or Cuyahoga or County in this, where we are. So we are going to have to look at new money, and there's going to be a big ask coming either 28 or 29. And we've done preliminary estimates on what that ask will be. It will be needing to replace both the expiring levies, so it'll revert back to 2009 collection. So we'll get more money there, and we'll have to ask for 2 additional mills, which generate about $9 million in mills. 18. So we're looking at an $18 million ask plus a replacement, which is about, it's about 7.
Yeah.
So nearly $25 million ask come later in this decade. So we know that to be the case unless, something changes in our service delivery system. And that can certainly happen. It could be for the better, or between now and then, maybe for the worst, depending on some just events that are unseen. So do you just want to provide that kind of landscape of where we are? The fact is we're sitting so well right now, but we know that changes, and it changes pretty rapidly as we get to 25, 26, 27, 28. So, and what we've seen in immediate needs is exactly what we've been budgeting. So you're going to hear from Lisa Fairmore today about, the public perceptions that citizens and taxpayers have of us. That actually ties in very tightly with the discussion we're having right now. She and I are meeting tomorrow with a public communications firm up in Cuyahoga Falls to talk about a public awareness campaign for 2022 that then will go into our campaign in 23, which will run about 6 months. So what we're planning initially and preliminarily is not to spend as much on this levy campaign as we did in 2013. We don't want to go too small, but we want to save the Citizens Who Care Political Action Committee money for that campaign that's coming later in the decade, because this is going to be a huge ask that we're going to need, to, really focus our attention and our resources on that campaign. So that's our story today. So, plans to address workforce crisis in the short term, addressing immediate needs for the people we serve and families in the short and long term, and then kind of prophesying out towards later in the decade, a big ask of our community, trying to make sure that we are telling the story, being upfront with the story of our resources that we've been entrusted. So we're gonna finish this year very, very well, better than we ever have before. But if that story changes, even with the passing of this 2023 levy, and it changes pretty rapidly towards the end of this year. So a lot of territory, hopefully short amount of time. Are there any questions that maybe you have on where we are, why we are, or where we're going?
But not related to this.
Yeah.
So I'll wait. Just wondering in anticipation, of watching what's going on in Washington this week. Potential shutdown. Does that affect us in any capacity or those that provide services to us or along with us?
It shouldn't affect direct services. So we should be okay, and we will be okay. Because in the event that there is a shutdown and it would slow some federal money, we would use local money. And that with the full knowledge, if it is like other ones, that we would be reimbursed for that time that we spend.
Thank you.
Yeah, but it's very good question, very timely question. Hopefully it doesn't happen, but we're prepared financially because we are in such a good financial position to address slowdown in reimbursement. That should be used for our providers.
Thank you.
So I think that's my cue. Thank you very much.
Okay, thank you. Committee and department reports are in our board packet. Are there additions or deletions? With none, we do not have any old business or new business, so we'll move to presentation by Lisa Paramore, Communications Manager. Senior poll results and what the polls indicate about citizens' perception of agency.
And height between me and Bill. That's the right adjustment. Heels on tonight. Well, good evening. It is wonderful to see all of you. Bill gave a great segue into what I'm briefly going to talk with you about tonight. Our perception of what people know, knowing Start DD. You know, I have been using that theme for a good year and a half, and we are staying with that because, as Bill said, we are going to need to have people know Start DD more than ever going forward. So just to give you a little bit of background and reminder, that every year we do participate in the Start Community Poll that is conducted with the Center for Marketing and Opinion Research, or known as CMOR. They are local, they're out of North Canton, and they provide polling for a number of institutions, not only in our community, but also in the state. So we have seen universities, hospitals, healthcare organizations, as well as community-based organizations use polling. They, in addition to us, they also do polling for Summit and the Medina County Boards of DD. Finally, some of you, if you're parents, you may have talked to Seymour, but they also do monthly do our customer satisfaction survey with our families and our individuals. So they give us a lot of data and a lot of information. And so just to give you a little idea that we first connected with Seymour back in 2007, when we were getting ready, as Bill talked about levies, levy request. And this is the campaign that was there. And at that time, we were looking at trying to gauge the perception of Stark DD and the voters' willingness to either approve a 2.9 or a 3.9 mil request. So at that point, we wanted to figure out what to do, and so Seymour jumped on and started helping us do some polls. So how is the poll done? Just to review for you. So we are just one of several organizations that participates in the Stark County version of the community poll. We have no idea, unless you are one of those that receives the call, what other organizations are participating. When it is done, Seymour provides a written survey for each organization just of your information. So I have no idea what other organizations do it. We just get our information. In that poll, we ask 7 questions. So other organizations, they may have more they want to ask, they may ask less. That is up to each organization. In the poll, they have 600 total respondents that are contacted both through landlines or cell phone. The sample precision level is really quite high. And finally, the data collection, when it happened, they started this year on April 26th, and they were calling through most of the month of June. They call in the evening hours, and on the average, the interviews take about 22 minutes to get through the entire survey. So just imagine if you were that caller calling on a beautiful summer night, and you're saying it's only going to take 22 minutes of your time. Okay? Yes. So you can imagine, it took 2 months to get 600 people to stay on the line. Okay. So next, let's look at, we're just going to do a high level summary of. There we go. Okay. Kind of a busy chart. There is, if any of you want the full report, I have that and I can send it to you electronically. But just to show you, they do the last 10 years at a glance. And so if you'll see, there's a very faint red box around 2013. That's when we were last on the ballot. We had, as Bill mentioned, we've had some public awareness campaigns leading up to that. And then we were on the ballot that May. So what you're seeing in 2021 is it was rough. A lot of our services during the year, the past year leading up, were at home or we're teleworking. But what we can see is an increase. And as Seymour told us when she met with me, she said, honestly, I said, oh, I was hoping we would go up. We had the clinics here, we had exposure, we had people hearing about Stark DD. But she said, really, Lisa, she said, you have to be very proud because many of the organizations saw a drop this last year. And we still saw an increase in awareness and perception of our services. So the other thing, aware of services, as you can see, 45.8% of the people are aware. That is the highest it's been in 10 years. So again, it was a tough year, tough to have people knowing what we're doing, but we are one of the agencies that actually did. Finally. Okay, so I've got this up here. So when we were talking with Seymour, and what gets into my neck of the woods is, how do people hear about us? How do they know what we do? You guys get bored twice a year. I am always up here telling you, showing our ambassadors our story. But is that penetrating? And so it's interesting. When we have new employee orientation, we do that about 6 times a year. The HR department puts that on. There are several of us that get up in front of the employees. And this is my slide that I show to the new employees. And I say, you have to figure out your role in this agency. How are you an ambassador of what we do here every day? You have to figure out your education. And I'm not just talking schools. educating the families, educating your neighbors what we do. How do you help advocate for people with disabilities? How do we promote and expand the provider community and the importance of our collaboration together? So I challenge, and I know Karen Evans says several of us do that to new employees and to all of our employees. We have to be ambassadors of what we do. The interesting thing that polling was showing, and one thing's not going to surprise you, is that newspapers where people get their information, that is slowly going down every year from where people get their information. Not surprisingly, the internet, social media is going up. But you know what is the second one right behind newspapers and only by 3 percentage points? Guess where people are getting their information? Friends and family. They're talking to each other. So when I say we all need to be ambassadors of what we do, that is exactly why. We need to be out there as employees, as people who receive services and supports, as family members, talking about what we do, the value that we bring to families. Because we can do all kinds of newspaper ads, billboards, yard signs. Not out there being ambassadors for what we do. Then we're missing. So, anyway, sorry, got a little preachy there. Anybody have any questions? Again, if anybody would like to see the full report, Bill and I have it. We would be more than happy to send it to you. You can, talk to Bill and I. Thank you, everyone.
Okay, thank you. At this time, we'll have a review of policy slated for first readings with full director of Human Resources presenting the policies.
Good evening. Policy 2.02, individual service planning process was reviewed with no changes. Policy 2.03, functional departments. A slight revision was made to remove health and therapy services and add early intervention and nursing services. Policy 2.09, corporate compliance program, was reviewed with no changes recommended. Policy 2.14, abuse awareness and prevention. This policy was revised to include language that addresses what are appropriate and inappropriate interactions between employees and children, youth, and adults with developmental disabilities in order to reduce the risk of abuse by an employee. Also, the policy states that the board's crisis communication plan will be utilized if a crisis condition exists pertaining to a situation of abuse. These revisions were recommended by our insurance company during renewal and broaden our previous policy and help to clarify acceptable and unacceptable employee conduct to reduce the risk of abuse. Policy 2.23, research and experimental programs, was reviewed with no recommendations for change. Policy 5.19, non-routine use of school buses, was reviewed with no changes recommended. Policy 5.20, Ohio pupil transportation operation and safety rules. A slight revision was made to remove a portion of a sentence that was repetitive. And finally, policy 6.03, IT confidentiality policy, was reviewed with no change. Thank you.
Now we'll move to resolutions. We have resolution 093321, approves the board expenditures for August 2021. I need a motion.
Vicky moves.
Give me a second.
Anderson seconds.
Thank you. And discussion from Lee.
Good evening, everyone. Our revenues for the month of August, we had 225,000 in local revenue, 222,000 in state, and 333,000 in federal, for total revenue of 781,000 for the month. We had 2 payrolls during the month, 1.1 million, total benefits paid of 190,000. Total other expenses of just under 7 million. Please note, we did pay a waiver match payment as well as our 5th invoice that we get each year. That total was 6.4 million for the month. Looking toward the bottom, we started the year with $52.4 million. At the end of August, we had 4.3 million in open purchase orders. We have canceled 886,000 in 2020 purchase orders. And with our positive net change in financial position of about 2 million, we end with $51.1 million in cash. And which reduces with our reserve balance, we actually have $41.1 million in unencumbered cash. Looking at our year-to-date budget versus actuals, our year-to-date revenue of 36.5 million, which is 71.65% of what we expect to receive. And total year-to-date expenses of 34.5 million, which is 65.36% of what we expect to spend. Our target is 67% at the end of the month. Over looking on the far right, our available budget at the end of August is 14.05 million, again, mostly made up of personnel. Our prior year encumbrance report activity, you can see we carried over 1.1 million in 2020 POs. Paid 255,000 from those purchase orders this year, canceled 887,000, and we have 0 remaining in prior year POs open. Now looking at resolution 093321, you can see our 2 payrolls there totaling 1.09 million, and then our week by week breakdown of our non-payroll expenses totaling 7.13 million. If there are no questions, requesting approval of resolution 093321.
Okay, thank you. All in favor of the resolution, say aye. Opposed, say nay. No abstentions, financial strong. Moving to second reading of the board policy presented at the August board meeting. Presented by
Policy 4.11, program discipline and corrective action, was reviewed with no changes recommended. Policy 4.29, family medical leave, was also reviewed with no changes recommended. Policy 4.37, personnel records, did have several revisions to add background checks and registry checks to the policy. And also we inserted a sentence about personnel records being stored electronically. Policy 4.39, drug-free workplace. This policy was revised to add a sentence that if an employee is prescribed medication that may cause drowsiness, they do need to report that to their supervisor. Policies 4.59, administrative leave, 5.13, food service, 6.19, wireless access, and 6.23, electronic communication were all reviewed with no changes recommended. Thank you.
Okay, that brings us to resolution 093421, providing approval for board policy presented for second reading. Any motion to approve?
Alva Lang moves.
In second,
Anderson seconds.
any further discussion? With none, all in favor of the resolution, say aye. Opposed, say nay. Any abstentions? With none, board policies are approved. Okay, just a reminder, our next meeting is slated for Tuesday, October 26th at 6 p.m. And with that, I now need a motion to adjourn. Second.
Alva Lang second.
All in favor, say aye. Opposed, say nay. No abstentions. You're now adjourned at 6:42.